Welcome to Smoke Break, a production of Native American Medical Educational Services. Welcome. This program is created to help you put the brake on tobacco addiction. The information presented is designed to give you the knowledge and power to help you break the habit of smoking cigarettes or using smokeless tobacco. The following are chapters in a unique tobacco cessation program. Intro to tobacco, statistics, tobacco companies, diseases of tobacco, brain domain, brain drain, medication, education, and tradition, not addiction. Intro to tobacco. Tobacco, one of the wonders of plant life. Native peoples of the Americas grew and harvested the tobacco plant. The resulting product was used for medicinal purposes and in religious ceremonies. Here's some raw tobacco. Smoking the leaves in a pipe or rolled in corn shucks has been a part of ancient ceremonial practices for centuries. The ancestors believed that their prayers rose with the tobacco smoke toward the heavens where the Creator dwelled. And these ancient beliefs and practices are still upheld in Indian country today. But respect for this sacred plant has been lost by the habitual use of smoking or chewing commercial tobacco laced with chemical additives. Tobacco is an amazing drug. You don't have to wait at the pharmacy. You don't have to see a doctor for a prescription. You can get it anywhere. It is an antidepressant, but on the other hand, it will suck the life out of you. There are reasons why we smoke, dip, and snort tobacco. They are sociological, psychological, and biological. Sociological reasons include family, friends, society and culture like tobacco company advertising, peer pressure, and role models in movies and sports. Psychological factors: untreated depression, anxiety, schizophrenia, attention deficit disorder, and bipolar disorder may invite the need for tobacco. Biological reasons: nicotine may disturb the cells in the brain, causing an addiction. An addiction to nicotine may also be passed down genetically. Nicotine in tobacco stimulates the brain, activating the chemicals serotonin, norepinephrine, dopamine, and endorphins. The norepinephrine and dopamine chemicals may be restored in the brain by the medication bupropion, also known as Wellbutrin and Zyban. These are all the same antidepressant medications. Zyban is the marketing name for the smoking cessation medication. Norepinephrine calms down the withdrawal. Dopamine feeds the craving. Together, they help in smoking cessation and treating depression. So smokers and dippers, stop practicing neuropharmacology. Stop writing your own prescriptions for 1 to 2 cigarettes every hour to treat anxiety.
Therefore, stop smoking your antidepressants and your anti-anxiety medications, take the seeds out here, and start taking the pill form. After all, that's what it's all about, a healthier approach.
If one has a diagnosis of high blood pressure, then the treatment is medication and education with diet and exercise. A diagnosis of diabetes includes the treatment of medication and education. Physicians don't tell a patient who has uncontrollable blood pressure or diabetes to just stop it, to get over it. No. Likewise, with a nicotine or drug addiction, it requires medication and/or education. basic education for tobacco termination. It takes me to be tobacco-free, medication and/or education. Medication includes bupropion, clonidine, nortriptyline, and nicotine replacement therapy, such as the patch. Heal. Health education amends life. Healing begins with selecting a program, setting your stop date, preparing a first aid kit, get freed protocol, and a fall protocol. Statistics. This chapter on statistics or numerical data will reveal the startling number of Americans who have lost their lives to diseases caused by tobacco abuse. There is an immediate concern to address the numerous diseases and death from tobacco abuse. One human has just died from a tobacco-related disease by the time you have read this. One death every 10 seconds. The United States Public Health Service has 8 agencies. Let's go to the CDC for statistics. CDC data. Life lost from tobacco abuse. For males, 13.2 years. For females, 14.5. Normal life expectancy for males, 73 years, and for females, 79 years. Here are some calculations for minutes of life lost per cigarette. Let's take a 16-year-old female smoking 2 packs a day. That's a total of 6.8 million minutes of life lost. 730,000 cigarettes smoked in 50 years. Therefore, about 10 minutes of life lost per cigarette. That comes to 6 hours of life per day. 1 year of being sick during a lifetime of work. That means 6 days of lost work per year. When lifelong smokers are over 50 years old, 1 out of 6 will die from tobacco-related diseases.
If for the first time somebody brought to the American shores tobacco containing nicotine and we had a package insert that told us everything that we know about it, the government would take steps to ban it today, and if they didn't, there'd be a revolution in the country.
These figures represent American lives lost in all the wars and armed conflicts in our nation's history. It represents over 624,000 combat deaths. From 200 years of wars and conflict, over 624,000 American lives lost. But from 2 years of tobacco diseases, over 860,000 American lives lost. That comes to over 1,000 American lives lost per day. We lost over 47,000 in combat deaths in Vietnam between 1964 and 1975. Yet we lose over 50,000 Americans every year from secondhand smoke.
There's a big debate about smoking in restaurants and bars. Some people argue that separate sections and filtration are enough to keep non-smokers safe from the harmful effects of secondhand smoke. It would be like having separate sections in a pool, peeing and non-peeing. Would you feel safe jumping in? Pretty disgusting, but so are heart and lung diseases caused by secondhand smoke. This is not against personal rights. It's for public health. Show your support to regulate smoking in public places.
There are more deaths from tobacco per year than from HIV, alcohol, motor vehicle accidents, homicide, suicide, and drug abuse combined. Tobacco companies. Once European colonies were established in America, commercial trade with the Indians soon began. Metal goods, farming supplies, furs, and tobacco became the trade goods of colonial America. But the history of tobacco trade has proven that Commercial tobacco companies are more concerned about their profits than the health and well-being of tobacco consumers.
Imagine a business that made a product that killed up to 1/2 of their best customers. It wouldn't kill its users suddenly, but slowly and insidiously through poisons that cause or exacerbate cancer, heart disease, strokes, and lung disease. Imagine that the companies knew their product was deadly and addictive, but kept manufacturing it anyway. Imagine that the companies spent billions of dollars every year dying customers through advertising campaigns that hook new users, especially young ones, by making the product look fun, sexy, and inviting. Meet the cigarette.
The allegation that smoking cigarettes is addictive is part of a growing and disturbing trend that has destroyed the meaning of the term by characterizing virtually any enjoyable activity as addictive, whether it's eating sweets, drinking coffee, playing video games, or watching TV.
Of course, the industry said that smoking is no more dangerous than eating Twinkies. Well, you read the back of the label of Twinkies, guess what you see? What coloring is used, flour, starch, sugars, and all. Turn over your pack of cigarettes, what do you see? You don't see any of it. We need some labeling. We need some clear technical understanding. That's just the same thing you would find on the back of your Twinkies.
This morning in your written statement and your oral statement, you compared cigarettes to coffee, tea, sweets, sugar, warm milk, cheese, chocolate, and Twinkies. That's quite a list. I'm struck by what I think is a calculated attempt to trivialize the devastating health impacts of your product. The difference between cigarettes and Twinkies and the other products you mentioned is death.
We're now entering Marlboro country. And the cowboy. Hey, what's up? We're here to see the Cowboys.
Who's that?
The Marlboro Man.
Marlboro Man.
Yeah, well, he passed away some time ago.
He's dead?
He passed away?
Yeah.
Is his horse still alive or anything? No.
No Cowboys, no nothing?
Could you give us directions maybe to the grave? There's no guy.
All the way to cowboy country, there's no cowboy.
And he's dead.
I wonder what killed him.
Yeah.
I know what you've done.
And I know what you're
doing.
You sell a product that contains addictive chemicals.
So your customers stand little
Or no chance of
ever being able to stop using it. Slowly, over time,
it kills 1/3 of them.
To replace those dead customers.
You tried to market your product
to kids as young as 13.
The fact is, you get 89% of your new business
From teens.
I've seen the proof.
It's in your own words, on your own letterhead.
Stamped top secret.
You screwed up.
when you tried to hide the documents.
And now they're on the web.
They're on the web.
I lost my grandfather.
My grandmother was manipulated by your lies for years.
My grandfather died because of your product.
Was the money you made worth it?
You've gotten rich, selling a product that kills over 1,200 people a day.
Every day.
So while you're lounging around your comfortable house,
Watching this message.
look into my eyes.
I know what you did.
And I know what you're doing. And that's why I got involved.
And I won't stop.
Until everyone else knows what you're doing, too.
All of you touch on it, and just yes or no. Do you believe nicotine is not addictive?
I believe nicotine is not addictive, yes.
Mr. Johnston.
Congressman, cigarettes and nicotine clearly do not meet the classic definitions of addiction. There is no intoxication.
We'll take that as a no, and again, time is short. If you could just, I think each of you believe nicotine is not addictive. We just would like to have this for the record.
I don't believe that nicotine or our products are addictive.
The tobacco companies hire scientists to design the most addictive product on this planet. Tobacco, when abused, is more addictive than methamphetamines, heroin, cocaine, or alcohol. Cigarettes are designed to deliver just the right dosage of the addictive drug nicotine to make it difficult to quit. Then they take the tobacco and make it more addictive by adding chemicals. Although some of these chemicals were found to be dangerous and cancerous, these additives were not removed by order of the company executives. They were concerned that it would impact sales as their product would release its grip on some consumers. These companies want to hold their customers captive, even though they will suffer and die sooner.
Lead, ammonia, a household
arsenic
cleaner,
used in rat poison,
benzene,
butane gas used in lighter
carbon
fluid,
monoxide, a poisonous gas.
DDT, a banned insecticide.
Polonium-210, a cancer-causing radioactive element.
Other additives laced into tobacco are coumarin, a rat poison, nitrosamines, aldehydes, cyanide, arsenic, formaldehyde, along with all of these chemical additives. Is it possible to make these chemical recipes? Design these additives to make users only addicted to tobacco and not other drugs? These additives would most likely be programmed to alter your brain chemistry, to give you an overall addictive behavior and possible mental disturbance. These companies may be setting off a cascade of psychiatric illnesses and addiction beyond nicotine into crank, heroin, cocaine, marijuana, or alcohol. Thus, tobacco may be the gateway drug to polysubstance abuse. If you're planning to quit, and for those who are not, consider changing to a non-additive tobacco. Get through the additive withdrawals first. Some say the other brands taste bad. This bad experience may be from the withdrawals of additives.
One of the executives from R.J. Reynolds came over and said, "What are you doing?" And I said, "Well, I'm smoking." They said, "Well, you're still smoking that stuff?" And I said, "Yeah." And I said, "How come you guys from R.J. Reynolds don't smoke?" And he turned to me and he said, "We don't smoke the we just sell it. We reserve the right to smoke for the young, the poor, the black, and the stupid."
The tobacco company's profits are more important to them than your life and health. Diseases of tobacco. This chapter will take a look at the changes in your body after smoking or chewing tobacco. The resulting diseases are caused by changes in DNA, oxygen flow, and blood flow. DNA. The DNA molecules transmit special information needed for living organisms to develop correctly. DNA is the who, when, where, how, and why we are what we are. Deep within the nucleus of every cell is the DNA telling the cell what to be when it grows up. DNA and addiction. Some of these genes are expressed as physical and mental problems and diseases. Just as one may be a diabetic from genetic expression, likewise, some may be addicted to tobacco or other drugs. DNA and cancer. Some of the tobacco chemical additives are carcinogens or cause cancer. These carcinogens added to the tobacco and the nicotine alter the DNA cell expression, resulting in cancer. Additives also cause other devastating cellular changes that destroy life. Oxygen flow. When smoke is inhaled, the oxygen level is lowered and the tar, nicotine, and additives are delivered to the lungs. Here we have the normal lung anatomy with the bronchiole, the alveolar sac, and the bronchial wall. COPD, chronic obstructed pulmonary disease. Smoking tobacco causes COPD, comprised primarily of chronic bronchitis and emphysema. Chronic bronchitis, a productive mucus cough for over 3 months caused by lung pollution such as tobacco smoke. This illustration of chronic bronchitis shows the thickened wall, a narrow airway, and the mucus plug. Plugged up bronchioles cause poor oxygen flow into the air sacs. Increased mucus decreases the oxygen exchange into the blood. Smoking tobacco causes COPD, comprised primarily of chronic bronchitis and emphysema. Here is an illustration of the lung with emphysema. It shows a narrowed airway and an enlarged air sac. Air sacs are enlarged and have lost their elasticity or expandability. This loss in elasticity causes poor air exchange, a decrease in oxygen flow. Emphysema is permanent and may cause difficulty breathing. Medical treatment for COPD includes albuterol, ipratropium, inhaled steroids, and finally, oxygen. Smoking tobacco causes COPD, comprised primarily of chronic bronchitis and emphysema. This leads to lung infections and difficulty breathing. Here is a graph showing the health benefits of living smoke-free. It shows that lung capacity, or the ability to breathe freely, decreases as a person grows older. COPD in a smoker's lungs dramatically decreases their lung capacity and shortens their lifespan. So if one stops smoking at 45 years old, the lung capacity becomes stable. Even if one has reached the point of disability with severe shortness of breath and being on oxygen, when they stop smoking, the lungs can become stable, expanding their life expectancy for several more years.
This is part of an aorta, the main artery from the heart. Smoking makes artery walls sticky and collect dangerous fatty deposits. This much was found stuck to the aortal wall of a smoker, age 32.
Nicotine and other chemicals cause cholesterol or fat to collect in the walls of the arteries. This clogging causes heart attacks and strokes. Here we have a model of the heart. Arteries provide blood flow to the heart muscle. When an artery through which blood flows to the heart is blocked off, the muscle starts to die. This is called a heart attack. This model of the heart muscle shows on the left the red area of a good heart, and on the right, after a heart attack, the black area showing heart damage.
A stroke, sometimes called a brain attack, occurs when blood flow to the brain is interrupted. That can happen if a blood vessel breaks or gets blocked by a clot. When someone has a stroke, brain cells in the immediate area begin to die because they stop getting the oxygen and nutrients they need.
Somehow we have to get the hopeful message out that there is something you can do. It's not hopeless. And I think 4 or 5 years ago that was pretty much true. But now it's changed vastly. And the change is that now you can do something.
You have to get there early to get the best treatment. They need to be examined by doctors.
Close your eyes.
They need brain scans, like CAT scans, to know what the best therapy is.
If one is having a heart or brain attack, get to the hospital. Stat. Nicotine constricts or narrows the arteries. This dangerously reduces the blood flow to the organs, extremities, and skin.
To measure how smoking might already be making them different from one another, the twins volunteered to be tested at Lutheran Medical Center in Denver, Colorado. They were tested for lung capacity.
Karen, as we might guess, since you have been a non-smoker and you're young, your tests are unequivocally normal.
Blast it out.
Becca, your tests are technically within the normal range, but they do show some signs of early small airways disease.
Then Becca got a chance to see how smoking just one cigarette affects her body.
That will cause the skin temperature to drop.
With each drag, the nicotine in the cigarette begins to constrict Becca's circulation. Infrared pictures of her hand show the changes instantly.
You can see the blueness occurring up in her index finger now. That temperature drop is quite significant already.
In the time it takes to smoke one cigarette, Becca's hand turns from a healthy red to an icy blue.
Notice we're even getting a little purple in the tips of your fingers, which is down near the bottom of our scale. Now the non-smoker, if they would wiggle their hands, yeah, we know who it is. Your oxygen level has been dramatically reduced. And that's going to affect your entire body. Get real tight together if you give it. Oh, good.
Tobacco or nicotine abuse causes or is thought to cause the following diseases, adverse reactions, and side effects. Cancer of the lung, mouth, throat, bladder, kidney, stomach, pancreas, cervix, prostate, colon, and rectum. And also causes COPD, shortness of breath, halitosis, respiratory infection, chest pain, enlarged heart, a heart attack, irregular heartbeat, clogged artery, wrinkling of the skin, psoriasis, delayed wound healing, poor fracture healing, osteoporosis, osteoarthritis, ulcerative colitis, indigestion, peptic ulcer disease, worsening of GI reflux, ear infections, impotence, infertility, decreased sperm ability, mini strokes, a stroke, depression, anxiety, snoring, cataracts, hearing loss, gum disease, optic neuropathy, macular degeneration, blood sugar abnormalities, and impaired immunity. Babies exposed to secondhand smoke may have intellectual impairment, prematurity, birth defects, fetal growth retardation, and sudden infant death syndrome. And mothers may experience stillbirth and miscarriages. For pregnant and breastfeeding mothers, we support your efforts to be smoke-free for your baby. We want this program to be a non-condemning, eye-opening experience, encouraging you to nurture your baby's health. Thankfully, we have the smoking cessation medication and other supportive programs to help you quit. Brain domain.
Dr. Daniel Amen and the Amen Clinic work with a revolutionary brain imaging technique called SPECT that allows them to accurately see how the brain works.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological. In the research that I've done with SPECT, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, you know, change your brain, change your life, and that's what we've seen.
SPECT scans allow doctors to look at the brain in 3 dimensions. This is a brain of a long-time drug addict. When compared with a healthy brain, it is obvious where the holes of altered activity are.
And sort of the scalloping appearance, where it looks bumpy across the surface, is what we see in toxic brains. Well, the scans don't lie. What we find is that people who use drugs, who use alcohol, damages brain function. What we see is this overall decreased activity in the brain from substance abuse. Well, the good news is that if you stop using, your brain may get better. We've seen a lot of healing take place in brains that have been damaged with drugs and alcohol.
When a smoker inhales a puff of tobacco smoke, a bolus of nicotine is delivered to the lungs. It rapidly traverses the alveolar capillary membrane, passing through the pulmonary veins, the left atrium, the left ventricle to the aorta. From here, it is distributed in high concentration to the entire body, but especially to the coronary arteries and straight up the carotid arteries to the brain.
In the nicotine-addicted individual, nicotine, particularly with the high and rapid dosing, which the tobacco cigarette provides, produces beneficial, pleasurable, and cognitive central nervous system effects. The sudden elimination of tobacco, and hence nicotine, produces a wide range of unpleasant nicotine withdrawal signs and symptoms. How is it that nicotine can have this profound an effect on the brain, on human behavior, emotions, thought, and intellectual functioning?
To understand how nicotine has such an effect on the brain, we must explore the brain drain. Different parts of the brain have special jobs to perform. Such jobs as movement, sensation, judgment, pain, memory, vision, and coordination. And we see the reward pathway. When nicotine is absorbed, several areas of the brain are increased in chemical activity, thus a reward response. A reward pathway is one of the locations of the brain's drug craving and addiction. One of the chemicals that activates the reward pathway is called dopamine. Here we have an illustration of the smoker's brain before and after a dose of nicotine. When the smoker or dipper absorbs nicotine, the reward pathway is increased in activity. Now zoom in microscopically to see the synapse in action. The brain has axons that transmit messages to different parts of the brain, like telephone lines. These phone lines travel to different parts of the brain, giving them messages that stimulate thoughts and actions, such as eat, walk, and smoke. These are the neurons, or nerve cells, of the reward pathway. A neuron has a special connection, a gap, called synapse. The synapse of the brain is like the kitchen sink that holds the chemicals together, such as serotonin, norepinephrine, and dopamine. This is a model of a balanced synapse with all the chemicals together, with an equal amount of serotonin, norepinephrine, and dopamine. Within seconds of inhaling cigarette smoke, a rush of nicotine travels into the brain, increasing chemical activity. This activity releases the norepinephrine and serotonin systems. Together, they enhance memory and concentration and decrease anxiety. Then the dopamine system is energized, that calms down the withdrawal feelings and increases reward activity. The released endorphins provide the pleasurable sensations. The neurons in the brain need the right amount of chemicals to work properly. If there are not enough chemicals in the receptor sites, such as serotonin, norepinephrine, dopamine, and endorphins, then the brain does not work correctly. The drain determines how much water stays in the sink. We need the right amount of water in the sink, not overflowing or dry. Just as an engine needs oil to lubricate, gasoline to run, and water to cool the motor, consider the brain needs serotonin to lubricate, norepinephrine to run, and dopamine to cool the mind. the brain works great with the right amount of chemicals in the receptor sites. Just as some have problems with their genetics, causing diabetes or obesity, some may be low on these chemicals, causing depression and anxiety. Some receptor sites may be normal in chemical activity. Then, when one starts abusing tobacco, the nicotine agitates the neurons, causing the feeling of being low on the needed chemicals. This is the origin of addiction. If the receptor site is low on serotonin, norepinephrine, and dopamine, then one may have problems with depression, anxiety, or drug-seeking behavior. This is called a chemical imbalance. Depression is feeling unhappy, sad, gloomy, disappointed, dissatisfied with life, or heavy-hearted. Anxiety is the feeling of worry, dread, fear, tension, or stress. Imbalances in neurotransmitters, loss of production, and changes in receptor numbers and binding affinity are key to mood and addiction. To make a long story short and simple, consider the following synapse models to get a visual of the brain in action. This graphic shows a balanced synapse with equal amounts of serotonin, norepinephrine, and dopamine. This graphic shows a synapse out of balance. Low on serotonin can cause problems with anxiety and/or depression. Medicines that increase serotonin in the synapse one way or another are Prozac, Paxil, Lexapro, Zoloft, Effexor, among others. Medicines that increase serotonin may help in the treatment of depression and/or anxiety. This graphic shows a synapse also out of balance, low on norepinephrine and dopamine. This synapse imbalance causes problems with addiction and/or depression. When low on norepinephrine, one may feel lazy and less alert. Normal levels may increase energy and alertness. When low on dopamine, one may have problems with attention, motivation, pleasure, and reward activity. The dopamine surge is one of the promoters of drug-seeking behavior. This is the reward pathway. Some are missing the neurochemistry for peace of mind. This chemical imbalance may be restored with the right medication and/or education. To chemically increase the norepinephrine and dopamine in the synapses of a nicotine-addicted individual, the drug of choice is bupropion, Wellbutrin, or Zyban. They're all the same medication. Pretend it is safe to smoke and very dangerous to take antidepressant pills. Now tell someone to stop his or her antidepressant, because if they don't, they can expect to die in 40 years when they could have lived 50 years. What would be an acceptable response to this order? One might say, I would rather be happy for 40 years than depressed for 50. In a laboratory experiment, 20 subjects were tested. 10 received IV normal saline and it had no effect. The other 10 received IV cocaine. Half enjoyed the cocaine, wanting lots more. The other half did not like it and wanted to pull out the IV. Some people have enough dopamine and do not want any more, while others need and seek to find their dope to cope. Now this illustration presents some interesting questions. Which state has the lowest tobacco usage per capita in the country? Utah. Now which state has the highest antidepressant prescriptions per capita in the country? Yes, it is also Utah. We will get our dope to cope. Medication. Addiction is a disease, so medication is an important part of your effort to break the habit. This chapter will guide you through the medications available to treat the disease. Now, this is intended as a guide, so make sure that you consult your pharmacist or medical practitioner before taking any of these medications. It takes me medication and/or education to be tobacco-free. First-line medications are the U.S. Public Health Service recommendations from the Clinical Practice Guideline book, Treating Tobacco Use and Dependence. The first-line medications include bupropion and nicotine replacement therapy. Bupropion, also known as Zyban or Wellbutrin, is an antidepressant. The recommended dosage is 150 milligrams every morning for 3 days. Then go to twice a day, once in the morning, once in the evening, about 8 hours apart. Start 1 to 2 weeks before the stop date, and take for 3 to 6 months or longer. The abstinence rate from smoking is about 30%. When taking bupropion, norepinephrine calms down the withdrawal. Dopamine feeds the craving. Together, they help in smoking cessation and treating depression. There are contraindications when taking bupropion. Don't ever use this medication when there's a history of brain disease or seizure disorder or eating problems such as bulimia and anorexia. There are precautions when taking bupropion. Be careful if there's a history of seizure risk, head injury, brain tumor, liver or kidney problems. If so, contact your practitioner. If one is seeing a specialist for bipolar disorder, psychosis, or some other type of psychiatric problem, contact and inform your doctor first. If there is heart disease, such as congestive heart failure or a heart attack, inform your provider before you start any medication. There may be drug interactions when taking bupropion. Do not consume excessive alcohol. Do not take with certain psychiatric drugs or drugs that may cause seizures. Do not take with street drugs. You may use it with nicotine replacement therapy, such as the patch, but monitor your blood pressure. If taking other medications, ask your pharmacist about drug interactions. Now, when taking bupropion, there may be adverse reaction, possible side effects. You may experience some of them, the most common being anxiety and insomnia. If one develops the side effect of anxiety, problems with distress or irritability, consider trying a second-line medication such as clonidine or nortriptyline. You may experience insomnia, but that may be resolved in a couple of weeks. Now, this may be a side effect of the nicotine withdrawal or from bupropion. Some already have this problem, and it may get better or worse. Just take one pill in the morning for several weeks. If the problem continues, take the bupropion dose closer together, say 6 or 4 hours apart, or consider clonidine or nortriptyline. Nicotine replacement therapy helps to dampen the withdrawal that comes from the oral and hands-on habit. Some researchers state only about 10% abstinence from smoking rate, others up to 30%. The dosage depends on the type and amount of tobacco use. Start the same day as the stop date. Don't use the nicotine replacement therapy while smoking, dipping, or snorting tobacco. Now, be careful before starting nicotine replacement therapy, such as the patch, if you have an allergy to tape. And be careful starting any nicotine replacement therapy after a heart attack or stroke. If you have any serious diseases or physical problems, consult your physician or pharmacist first. Drug interactions. Now, there are many, as tobacco is a dangerous drug. However, you may use the patch with the inhaler or gum for breakthrough craving when one has the overwhelming desire to smoke. Now, there may be adverse reactions such as strange dreams, a fast heartbeat, and high blood pressure. So check your blood pressure 1 to 2 times per week, and it must be less than 130/80. If you experience withdrawal symptoms, then taper down slowly. And if you experience a skin rash, try an over-the-counter topical steroid or change the patch site. If your patch falls off, put it in your sock or tape it back on, and keep patches away from children. The U.S. Public Health Service recommendations for second-line medications are clonidine and nortriptyline. It's considered if first-line medication is not working and/or there are problems with side effects. Clonidine is a blood pressure medication. The recommended dosage comes in transdermal or a patch or in tablet form, 0.1 milligram to 0.3 milligram in the morning and the evening. Start 3 days before your stop date and work the dose up slowly. Take for 3 to 6 months. The abstinence rate is about 26%. Nortriptyline is an antidepressant, and the recommended dosage is 25 milligrams 3 to 4 times per day. Work the dose up slowly. Start 3 weeks before the stop date and take for 3 to 6 months. The abstinence rate is about 30%. If one has started an antidepressant such as bupropion or nortriptyline for smoking cessation and finds this medication improves his or her quality of life, consider staying on that medication after tobacco termination. Knowledge is power, and education is your key to having the power to terminate tobacco abuse. This chapter on education will help you heal yourself and become free from smoking cigarettes or abusing tobacco. Education heals. Health education amends life. Healing begins with selecting a program, setting your stop date, preparing a first aid kit, get freed protocol, and a fall protocol. Selecting a program, such as medication, counseling, and behavioral therapies. Stop pulling over every 30 minutes to pour water in your radiator. If your radiator is leaking water, fix it. So stop pulling out a smoke every 30 minutes to pour norepinephrine and dopamine into your synapses. If you have a chemical imbalance, fix it. The excuse abuse. Are you having a problem with a medication side effect? Don't make it your excuse to start smoking and dipping. Contact your health practitioner or pharmacist for medication consultation. Counseling. Consider the smoking cessation success rate for individual, group, and telephone counseling at 17%, 14%, and 13% respectively. Add this success rate to those of the smoking cessation pill and patch, and one has a better chance of being smoke-free. Consider this same approach of adding several programs like medication, consultation, and behavior therapies to be drug-free. Behavioral therapies. You might consider going cold turkey. That's when one stops all tobacco at once. and withdrawal symptoms may last up to 2 weeks. Many people have thoughts of hurting themselves or others when attempting to go cold turkey, so one should be careful when stopping their antidepressant. Tapering is removing 1 cigarette from your daily dose each week or month. The following week or month, remove another cigarette. Setting your stop date. Plan your stop date as a special event to be celebrated for life. Schedule this date during a low-stress time of the week or month. Prepare medication and education for tobacco cessation. Healing begins with preparing a first aid kit containing oral goods and paraphernalia to hold off the withdrawal. These are some suggested materials for your tobacco cessation first aid kit. As you can see, some are for extreme measures. Get freed protocol. Get family and friends for support. Get medication to restore the chemical balance. Exercising and eating healthily. Exit plans from the temptations. Drinking lots of water. Doing something else. Take deep breaths and get delayed. The urge will go away. Fall protocol. The protocol for fall. Don't fall off the wagon. Follow up with your practitioner. Assess and address the cause. Learn from your fall and look for other programs and plans. It may take several falls to conquer the withdrawal. For additional information and resources to supplement the Smoke Break Tobacco Cessation Program, refer to Fresh Start, provided by the American Cancer Society. Also, the Centers for Disease Control and the National Tribal Tobacco Prevention Network. There is a light at the end of the tunnel. Search to find the medication and/or education for your tobacco termination. Misuse of tobacco leads to an astonishing rate of disease and death among American Indians. Tribal governments and ceremonial leaders must demand that we stop the abuse of tobacco. And Indian country is joining a growing trend in America today to restrict tobacco and prevent further danger to health. Natural tobacco has been a part of Indian tradition and culture long before Europeans came to America. And commercial interest in tobacco occurred soon after contact, but it has evolved into a dangerous practice that is killing our people. The ceremonial use or sacramental offering of tobacco should be considered the only appropriate way.
Endatsi Wakanda, Wakanda Jinki Awatai. Again, we come here this day. We thank you for all these blessings that you have given us, Almighty Grandson, your father started smoking at a young age. when he was in the service. He began smoking several packs of cigarettes every day and became addicted. He knew better when he got older, but he was already hooked, and that led to his early death. Smoking cigarettes is not the traditional way of using tobacco.
What do you mean, traditional way? Smoking is smoking, isn't it? A cigarette is like a peace pipe.
No, grandson. We have ceremonial ways of handling and using tobacco. It is a gift from the Creator. I offered tobacco this morning in a prayer. This was taught to me by my grandfather. We use pure tobacco in our pipe ceremonies or offer it as a gift. The cigarette companies, they poison their tobacco with chemicals, making it addictive and deadly. Grandson, I want you to live longer than your father ever did. So get rid of those things. I know it's not going to be easy to quit, so I'm going to help you. We use this tobacco in a powerful way, and we never light it up. These cigarettes have poisoned our people for many years now. But our traditional ways have kept our people around for countless generations. So let's go outside and practice the ways of our ancestors.
If we remember the lesson of tradition, not addiction, we will honor the ancestors, respect ourselves, and provide a healthy future for those to come.